and welcome to our next up MTI Live. Also joined with the BioTools Innovator BTI program as well. So really excited to be talking to you guys today. This is always my favorite part of the week with four fantastic panelists all about marketing and branding. So very important topic for medtech companies and biotools companies to consider, and not one that people often think about super early in their development process. They'll usually, come up with a name, make a logo, and won't really go much from there. So really looking forward to hearing from these fantastic panelists today on how you can actually utilize your brand to unlock your potential of your technology, of your customer base, and where you're going in the future with your products. So as many of you guys know, changing the standard of care in medicine through these innovative technologies that our startups in the MTI and BTI programs are developing often requires reshaping the narrative on how these technologies can impact all of these stakeholders. So patients, hospitals, physicians, and the healthcare system at large. So the story that you tell can have a profound impact on how well your product is perceived and ultimately how well it's adopted as well. So our expert panelists are going to be talking about, how do you optimize this messaging for medtech and biotools technologies, drawing on successful case studies that they'll share with you, and how do you reflect the heart and mission of your company within your brand. So really excited to be joined today, again, by four incredibly talented and diverse panelists with backgrounds within, the medtech space specifically, and have worked with messaging and branding in many different contexts. So we've got with us Brandon Morris, who is our Senior Director of Marketing at MedTech Innovator. So very excited to have him here today sharing his insight from the other side of this. Lauren Nobles, who is the Founder and Chief Persuader at Pazanga Health Communications. I always love that job title when I see it. Nick Tipman, who is the former Chief Marketing Officer at Greenlight Guru and is now also an investor, an advisor, and founder himself. And Shyam Natarajan, who is the CEO and co-founder of Avenda Health, who is actually an alum of our MTI program from the 2017 cohort. So really excited to hear from all of these panelists here today. For our cohort joining, if you guys have questions for the panelists, please start to put those into the Q&A box that you see at the bottom of the webinar. You guys are used to doing this by now. We're going to tackle a lot of our cohort questions in the last 30 minutes. For those joining us for our first hour, which is live on LinkedIn, if you guys have questions for the panelists as well, be sure to type those in the LinkedIn event, and we'll try to tackle those during the first hour that's live streamed. So without further ado, love to hear from our panelists themselves. So let's start off with Brandon. Can you give us an intro on your background and why you got into marketing?
Yeah, certainly. Thanks, Nicole. Brandon Morris, as noted, I'm actually a MedTech Innovator employee for about 1 year now, which has gone by very quickly, and it's been a tremendous amount of fun. I'm a lifelong marketer. I actually graduated university with a degree in journalism. Turned out journalism was a hard field to break into, so went to the dark side of doing more commercial types of communication, and that's been really enjoyable. Started off my career in doing some agency work, primarily for consumer packaged goods and then some high-tech applications. And shortly in my career, learned that living in the Northeast, there's a tremendous medical and technology and biotech ecosystem. And that seemed like a great place to make a career that balances my interests of telling good stories and doing things that actually make the world a little bit of a better place. I've had the chance to work for some fairly large medical technology companies, but I've really found my niche in working in some of the smaller startup or mid-stage companies, where I get to have both a hand in strategic and tactical kinds of things. Starting off as a copywriter and a graphic designer, I love doing those kind of hands-on types of marketings, but also really learned to pivot and love the more strategic, intellectual, and scientific side of marketing as well. So here at MTI, I'm responsible for doing a lot of our own branding, a lot of our own storytelling, helping to market our programs, especially during our application season coming up, and also getting the chance to work with some of our startups in a consultative sort of role, which is tremendously exciting as well.
Thank you, Brandon. We're super lucky to have Brandon on our team. Every time I go to an event and I just see how great things come together, all of the branding messaging from that, I'm just so blown away by all of Brandon's work. So very lucky to have him on our team and help him, see him also help our startups share their stories as well. So next up, we've got Lauren Nobles from Pazanga Health.
Hi, everybody. Laura Nobles here. And I've been a lifelong marketer. I guess I fell into it by accident in college. I was an accidental rhetoric major. Took a class freshman year and just loved it. I just like telling stories. I like persuading people, as you can see in my title. And I've worked across industries. So I actually wanted to be a journalist early on as well, Brandon. I interned at CNN during my time at Berkeley and just discovered it was a very tough life also. And so I went to the dark side too. And when I graduated, I was in technology, I was in consumer packaged goods, I was industrial, all kinds of stuff. And then I landed in healthcare after the dot-com bubble in around 2000 and fell in love. I love this industry. It's so complex. It's always moving. It's obviously a very personal industry because we're all talking about healthcare. And I was at an agency for 5 years that got bought by Porter Novelli and decided at that point, after an earnout, to start my own business, which was 2006. And I can't believe it's been that long. But I just love what we do. Have a wonderful team of senior people across the country, and we do everything in healthcare. Primarily med tech, just because that's my passion. But we are broad in healthcare. And what I like to say, to make it easy in terms of what we do, is we do everything in the communication spectrum with the exception of IR. So those are specialists that, if our clients are public or they need IR, they have their IR firms and we, work together. But we can help, startups, we can help brand name companies. We can be an outsourced marketing department. We can be a partner on, specific programming. But again, I love what I do. I love being part of MedTech Innovator. It's so fun to meet all the cohorts every year and see the cool things that people are doing. I'm sure I, like many of you on the call, personally benefited from clients and companies that I've just met in this space, just helping myself and my family. And it's incredible space. And kudos to all of you who are on this call that you made this cohort this year, because that's not a small feat. So looking forward to the conversation today. Thanks.
Thank you so much, Laura. And Laura is a fantastic supporter of our MTI community. She's mentoring about 10 companies or so, which I think is the most of any single person we've got. So really lucky to have her and her unique expertise on our mentoring squad. And next up, we've got Nick Tippmann. So very interesting background here. And Nick, as he'll describe, worked at Greenlight Guru, which is more of a B2B type company. So I would say fits more into like sort of the BioTools sphere. So shout out to Jim West, who leads our BioTools Innovator Program. For those of you listening on LinkedIn aren't familiar with that, but you know of a company, or maybe you're starting a company yourself that is more in the like B2B diagnostics or lab tool space. Think new microscopy techniques, new software that other scientific companies can utilize. Definitely look into that program. Really great traction we're seeing from those companies, and exciting innovations. So Nick, love to hear more from you.
Yeah, thanks, Nicole, and excited to be back here with the MTI crew. As mentioned, previous to what I'm doing today, I was the Chief Marketing Officer at Greenlight Guru. We're a B2B vertical SaaS solution specifically for the medtech industry. Help med device companies like yourself get approved by the FDA, EU, Health Canada, and then keep your devices compliant once you get to market. Helped build that company over about a 9-year run. Worked very closely with MTI over those years. I think was a judge and a sponsor and mentor for 5 or 6 years. Got to work with many of the cohort companies. Very excited to be back. I'm an entrepreneur and marketer both by trade. Fell into the medtech space with Greenlight Guru. Prior to that, started a media company focused on startups and entrepreneurs outside of Silicon Valley. And then now have been in the venture and investing space for the last 1.5 to 2 years now, mentoring, investing, and advising in vertical SaaS companies or digital health, BioTools, all of that, and really, really excited to be back with all of you today.
All right, thanks, Nick. Yeah, someone who's previously worked with Greenlight Guru, I'm excited to hear the other side of that and how you came to all this success with it. Last but certainly not least, we've got Sham from Avenda Health, and again, Sham was in our 2017 cohort, so love to hear from you, Sham.
Thank you. So Sham Natarajan, co-founder and CEO of Avenda Health, actually came. I'm on this panel probably as a counterbalance to all the expertise in marketing. I certainly am not an expert by any means. I actually started my career as an engineer and a scientist, writing a lot of grants, at a university as a professor, and learning really early on that in order for the best science to get funded, in order for the impact to be had on the technologies that we build to be felt, you really have to communicate a story, a good story, and be really crisp and clear about how your whatever you're building, has that impact on a certain patient population, or, is worthy of getting funded, or is worthy of like getting to that next stage. And so from that experience, we actually started Avenda Health, spun out of a university in 2017, because again, won the local MedTech Innovator, pitch competition by just telling a really good story. We didn't actually have a company at the time. We just were a bunch of academics, but again, really understanding that telling a good story and having that branding of what you're trying to build is very important. And so Avenda Health is now a commercial stage health tech company focused on treating and personalizing decision-making for patients with prostate cancer. Our tagline is, we're bringing superhuman abilities to oncologists and surgeons to better treat prostate cancer and get the best outcomes possible. And so, I'm excited to be here and tell you a little bit about how we got through that journey and how branding impacted it.
Thanks, Sham. And I think your perspective is going to be very well appreciated by the cohort who are in your shoes as you were a few years ago and trying to make these decisions. So it'll be great to hear that. All right, well, we'll kick things off with a very important question, which is, when people think about a company's brand, they often think about, the name, the logo, maybe a tagline, things that, you set up very early in the stages of your company development. But what are some other aspects that are important to your brand that you should also make sure to consider and play a core role in it? Laura, maybe let's start out with you.
Sure, absolutely. Yeah, I'd love to take this question. I mean, the logo and tagline, if you have one at this stage, I mean, they're visible signs of branding, but really at the end of the day, it's who are you? What do you stand for? What are you trying to accomplish? So it is that narrative. And in fact, the logo and the tagline should reflect what that narrative is. So you really have to start by just understanding, who you are, why you're here, what you promise your stakeholders, what benefit you provide, what's your unique value, and looking at that across sort of the competitive landscape, because there's so much sameness of messaging just across industries, really. And so what we like to say is, just really, you have to be very deliberate and disciplined in how you kind of peel back the onion and really tell a differentiated story that's going to resonate, with all audiences, and then with messages to particular audiences. But I think, to Sham's point, it's really all about storytelling.
Yeah, I like that, why you're here. And especially for so many of our biotools and medtech innovator companies, innovator is in that. So what makes you innovative, unique, when there's, so many other potential solutions out there? Why are you really moving that needle? Brandon, you've something you want to add to that?
Yeah, I mean, Laura was absolutely spot on. And I think of two different ways I think about brand. Part of it is it's the promise you make to your customer, right? That's really, it's again, based upon those values, that mission and such. The other thing is the brand is what your customers think about you. And you often can't control that. You can influence it, but oftentimes it's their experience with all of the touch points in your brand, what they see, what they hear, what they feel, what they touch. Is what makes the perception of brand in their mind. And so absolutely agreed. It's got to start with kind of the ethereal concepts of what is your mission? What are the values that drive you? What is the big, hairy, audacious problem you're trying to solve in the world? And from a frank and kind of a discussion of those, the brand identity follows from that. And the companies I've worked for and worked with that have had really good, powerful, strong brands, it starts way before you get into color palettes and fonts and websites. It starts with the entire organization living the brand, because you can read the marketing fluff on a website, but if their experience with a customer service operation, a sales operation, a support operation does not reflect those same values, it doesn't matter how good the tagline is, the experience of the brand is not going to be positive. So it's going to be holistic, and it's going to start from the top, and it's going to be based upon kind of your vision and your values.
Love that answer. And, focus also on internal and, how are your team members experiencing your brand and propelling that toward their own objectives. So really like that perspective on it. Nick, what are your thoughts on this?
Yeah, tough to go after Brandon there. It was kind of a mic drop. Very, very well said, and Laura as well. But yeah, when I answer this question, we used to do a marketing onboarding group at Greenlight Guru about once a month for 6, 7 years, and this question would come up often, and would always start out with the definition of marketing, like what is the goal, what is the role of marketing, and would always say at the highest level there's two goals of marketing, and one is to change behavior, and two is to manage perception. And I believe those two goals align well with the two disciplines of marketing around direct marketing. So how do you change behavior? This is getting people to take action. It's kind of like sales in the written word. But the other half of that is your brand. And we say your brand isn't what you say about yourself. Your brand is how other people perceive you. And so your job as a marketer is to manage that perception. And yes, the logos, your colors, the font, like all of that, your style, all goes into that. But at the end of the day, like Brandon was saying, it's really every single touch point that potential customer, current customer, really any stakeholder has with your brand, and that interaction. Every touch point is a brand touch point, and will affect and influence how others perceive you. And so I like to say at the earliest stages of companies, where I think maybe some of you guys are, even if you do have a logo and some colors, you actually may not have a brand, because to have other people perceive you, it means other people have to know about you. And so in the earliest days, it's really about getting that message and getting your name out there so people can know who you are, to start to paint that picture and to understand that narrative in their head, so they can have a perception of you, which then all those points of kind of what goes into that matter, and affect how they will perceive you. But yeah, that's kind of how I think about brand at the highest level there.
That's also a fantastic answer, Nick. I really like this because it gets me thinking a lot too about, when people think about their personal brand and how you can relate the two. So, you yourself, how you display yourself through, your clothes. Obviously, people see that, your makeup. So I was just telling them before the call, this is like the one time a week I wear lipstick. So maybe it's because I want to come across, more professional on these. But, your brand is more than that. It's your personal brand. It's about your personality, how you approach problems, how you manage your time. And I think, very similar thing is true in a company. How you go about meetings, structuring your team. What are those internal workings that really define how the wheels turn? So love that answer, and a lot of good thoughts spinning there. Awesome. So we got a cohort submitted question from our BioTools program, which is very important, which is what makes up a brand message? So Sean, maybe you can take this one because you guys crafted a really strong brand message.
Yeah, so I think this is a little bit tricky because it depends on who your audience is, because we have a number of different brand messages for different audiences. We have the audience of investors at the earliest stage, right? You want to be able to convey that you're legitimate, you're a professional, and you're targeting some really big, hairy, unmet, clinical problem or clinical need. There's the brand for your patients, where you want to project, again, that this is something that is going to make them feel, secure, safe, or, something that they would benefit from. And then there's the audience of how you project actually internally within your own company. So I think company culture, brand messages are actually really important about how you project, what you're trying to build, how you're trying to go about it, and really, the ethos of what you're trying to achieve. And so we have this, term, when we say this, doctors sort of like cringe a little bit, but it's really powerful for internally in the company and who we really are, which is a democratization of healthcare, democratization, of high quality cancer care. When we say democratization, that sort of, evokes something that it's for all of us. It's, all inclusive. So I would say that what makes up a brand message is number one, understanding the audience. Number two, being able to communicate authentically who you are and what you're all about. And number three, a simple message. It can't have 5 or 10 different things in there. Sometimes as especially early stage entrepreneurs, we want to say all the cool things that we're all about and all the great things that we want to do. But the reality is people will only will remember 1 or 2 things. So what is the key takeaway that you want your audience to get from it?
I love that, especially communicating authentically. We see a lot of companies trying to be, the next Google or Facebook because their brands are so strong. But how do you, become the brand that is the next one that's not in the next of those categories, and your own standalone? So really like that authenticity lens as well to it. So Laura, at what stage of development should a company be working on their brand? We've got a lot of very early stage companies that are maybe still in academia or, raising pre-seed rounds. What if their product isn't finalized yet? How should they think about their brand?
Yeah, and I think this kind of came up in earlier conversation, but really from the beginning. I mean, you should know your true north when you start your company, and what you're trying to accomplish in that, again, that narrative, because early on, you're going to have to be talking to investors. Depending on what you're doing, you might be having to, get physicians on board, some KOLs, or whoever you're trying to influence at each stage of your company. So that doesn't mean you have to spend a whole lot of money, investing in a big branding project and, with all the bells and whistles, but, you should have your story down. And I think, I talk about it a lot, but the value program that you guys have at MTI, I think as a marketer, when I see that from the outside or as a faculty member, I think it's so powerful because that really helps frame the story in a way that's so applicable to the healthcare market and has, sort of messaging by different audience and all the important things that, that go into a medical device or a biotech device that's not like selling shampoo, which I've done. It's very boring. I don't recommend it. But you've got to have good data, you've got to save money, you've got to have great outcomes, all those things that you have to do. But I think, early on, you need to know your story. So I think at the point of inception, I mean, you've got medical device companies that have to go through long PMAs, right? So they have like 5-year studies or 3-year studies. And, the market needs to know that they're doing things and they're making progress. And similarly, if you're going for a 510(k) clearance, even though it's a shorter regulatory cycle, there's people you're going to want to influence along the way. And when you do launch your product, you want people to know who you are. So I think it's really important to start from the beginning.
I think that's a really great answer. And yeah, I liked your thought that, even just bringing in KOLs, you want to represent yourself in the best light to these. Brandon, you work with so many of these startups through MTI, do you think it's ever too early to start thinking about your brand, and how would you start crafting it? Oh, sorry, Brandon, you're muted.
No, I absolutely agree. I think it should be the first thing you do, and I think intrinsically it probably is. And maybe we don't think of it in terms of brand identity, but when you're coming up with what is the problem I'm trying to solve, what is the technological, scientific, clinical, medical problem that we're trying to address here, and what is my great idea? Why is that better than the other options out there in the world? That is the core of your brand right there. You've already kind of figured out here's my mission, here's what I'm trying to do. And that's the kernel of the brand right there. So if you're not thinking about it in terms of, I'm crafting my brand story, the minute you start to innovate, the minute you start to assemble an organization or even the idea of an organization that can address one of these challenges, you're starting to think about your brand. And I think the earliest you can solidify that and then make sure that is carried through consistently through every part of your operation. I think the companies we see that are going to be successful, that go on to launch products and have exits and all those kinds of great things they hope to do, they've figured that out pretty early on. That's the first thing they work on.
That's great. Really love too that Laura brought in our value program. So for those of you listening that aren't familiar, in MedTech Innovator, we run a value program to help startups determine what their value is for all of the stakeholders, for patients, providers, hospitals, healthcare systems. So looking at how do you also generate evidence for this? So we have a very intensive workshop followed by coaching sessions, and then finally an award we give out to really help motivate the companies to keep this at their heart. So I'm glad you guys both brought that together. Awesome. So for Shyam and Nick, you guys both worked in medtech teams with very impactful brands. How did you guys decide what is the important message to convey? So Shyam, we'll start with you, and then Nick.
Yeah. So this is fun because this is where as an entrepreneur, you can really A/B test your message and start talking to as many people as possible at, from the very early stages to even now. What I mentioned before, we're bringing personalization and better democratization to prostate cancer care. What I didn't mention is we're also doing it with multimodal spatial AI. So we have an AI message in there too. So one of the things that we did very early on is, do we go with an AI message or do we go with a better value or healthcare type of message? And it's interesting because it's not a static answer for the same audience. In 2017, 2018, it was the value message. In 2021, up until maybe even now, it's an AI message, but then now everybody's AI. So like value message is resonating better. So it's really about understanding what you want to convey and then just aggressively testing that message over and over and over again. There's nobody in the world that divines of a great message, when they're sleeping, and that's the message that they end up with.
That's a brilliant quote.
I like that. Yeah. No advice while sleeping. Like pressure testing. Nick, what about you? What are your thoughts on this and deciding what the core messages are to convey?
Yeah, for sure. I think it really does come down to who you're talking to and what you're trying to get across. And then once you kind of figure that out, the testing has really helped refine it and dial it in. But it really starts with your ideal customer profile or the personas that you're going after. And this is where maybe it's a slightly potentially more complicated in medtech and biotech because you do have so many stakeholders with the patients, providers, hospitals, market at large, your investors, internal. And so really when you're starting out with the messaging, you got to figure out who is this messaging for? And then once you understand who is it for, then I really like to dive deep into the research. I'm a firm believer that the best messaging and the best positioning comes from a deep understanding of who your ideal customer profile or who your stakeholder is. Because you really want to understand like what's motivating them, what's driving them, what's their personal pain, what's the business pain, what's their hopes, fears, desires, like what do they care about? And how can you have empathy and compassion for whoever it is that you are trying to reach? And the more you can put yourself in their shoes and understand their perspective and where they're coming from, it's really going to help translate into more impactful and effective messaging and positioning because you understand what they care about more. And so I've been through quite a few messaging projects over the years and launching new products and working with agencies and working with founders as well. And we all know that how important time is and how fast we got to move. And particularly with agencies, it can be tough because I think the best agency or the best way to go about messaging is actually often to take a step back, to take 2 steps forward. And it is to really do that research and go in depth. And it's kind of like very similar to finding product market fit. Trying to find your message market fit is very similar. You wouldn't build a product in a vacuum without talking to any potential customers or customers. I think the same way is how you come up with your messaging and positioning. You probably should go have 100 customer discovery interviews. Now, those could be the same interviews or similar as the ones you're doing for your product, don't have to be different, but it really is a throughput and a line. And so, yeah, when coming up with messaging, just really like to harp on the importance of understanding who it's for and doing your research, because it'll make everything easier later.
I love that. Yeah, especially message market fit. That's not a term I've heard before. So think really important to, not just what the product's going to solve, but how do you message that and how it's going to solve it. So, and part of our MTI program, is obviously about innovation, designing like the coolest next new products. Sometimes these end up being very scientifically complex, especially we've got a lot of, academic spin outs where this is the result of many years of, PhD level, postdoc level work. So Brandon, if your innovation is very scientifically complex, how might you think about simplifying its main points for incorporation into your brand?
That is certainly the challenge, right? And unfortunately, probably not a really good like silver bullet kind of solution. I think when you really focus on what differentiates you and what is the real value of what you bring, that's a good place to start. I think we've got the tendency to want to word vomit and dump all these great features and benefits and all the important reasons why, when really there's probably one thing or a small number of things that separates what makes you a better choice or a more appropriate choice for certain kinds of things, versus what is already existing out there. So if you can really hone in on differentiation and then find a way to demonstrate that clearly, I think that's probably the second part of that is the audiences we're dealing with in our markets probably are a little more scientifically minded, a little more clinically minded than others. And so they've got a propensity to want to see things like data, other kinds of some good supporting information. Good, powerful stats, I think, help tell a good part of the story. But at the same time, we're all human, and the stories that our brains recognize and hold on to are ones that engage both sides of the brain, both the rational and the emotional. So oftentimes that 1-2 punch of here's some really good data and here's some personal human impact. I think what we found through my experience in a number of different organizations is that that's a good combination. And that kind of engagement of both sides of the brain help things stick a little bit. So if you can simplify a message down to here's the direct impact, here's what's going to make a human's life better, and here's some information that supports our big, bold, hairy, audacious claim, that can be an effective combination.
And focusing on what is different, there's many other technologies out there, but if it's very complex, what is the unique thing that you guys are doing?
Not just what's different or unique, but what really matters, what's going to give impact. And I think that's where the kind of the data and the human story comes to mind. Is the product different color? Sure. Is the product somehow more effective? Does it work faster? Does it give a better outcome? Is there less risk? All those things that matter to a clinician, to a patient, to a scientist. That's the important part.
Yeah, for sure. So, all these great things in mind, Laura, how would you best focus your message to a few key critical points, knowing especially if you have many different benefits and differentiators to your product?
Yeah, I mean, it really takes discipline. The thing I like to scream from the hilltops is less is more. Just because we're so inundated as a society with our screen time and everything else distracting us. And there's a lot of noise. So, in fact, I had a client send us, they wanted an added page to their website and they sent us 1,300 words. And I was like, oh my God. So it really just takes discipline to, as you're going through your narrative process of trying to tighten it up, and understand, again, what I'm reflecting what everyone's saying here, who you're talking to, right? So, simplify, simplify, simplify. And, I think just jumping off of the question before about the scientific complexity, sometimes it makes sense to speak in deep science, right? Depending on who you're talking to, but other times it's just simplify it. And in the absence of having an example, sometimes you can use analogies to make people understand, how your technology works or why it's important, right? So I just think, it takes diligence, and it's so true. It's like Brandon said, when you start writing, even myself, and I work in this space and my team, when we start writing, and your propensity is to say so much stuff, but then you have to go back and really just hone it down. I just think it's a skill that's really important in marketing.
Oh, that's a great answer. So we had a submitted question from our BioTools cohort, which is they love their tools. What tools exist that can help someone hone in on their brand identity? Are there any software packages or anything you guys know of that are, you know, really helpful for this, or is it really more of a broad exercise? Nick, you want to take this one?
Could you get a little more specific on what they're looking for? Like to help with the messaging, is there any software?
Yeah, any tools to help them like decide what their brand identity is. I mean, so obviously we're all aware, you know, how to go about getting a logo, but like, I don't know, any like brainstorming softwares or anything you guys have used when focusing on this, or is it really more of like team exercises?
Yeah, I don't know about on the software front, but there definitely are some tools and frameworks out there. Don't have one specifically, but there's a whole discipline around the concept of narrative design. And so I would suggest looking into the concept of narrative design, and there's processes that go into that. Similar with like building your brand and brand exercise to go in and actually create those logos and colors and fonts and the design, because it does matter at the end of the day. It affects the perception that people have of you, and there are well-established processes to kind of go through that. But when you think about the narrative design process, it's really kind of a 5-step process at the highest level, if I can kind of remember the steps right now. But you're going to have to name your big change in the world. You're going to have to name why you're different, why you're better, what problem you're solving. You got to show people. We talked about the evidence that you have, and so this is where the story comes up. But then you got to show people that you can make the promise that you just had with your product, your brand, come true. You do that with case studies, both on the emotional and the logical, with data and stories, and then. What's really important and a way to hammer it home is to show what's at stake. And so why is this important? Why do and this is maybe oftentimes more obvious in med tech and biotech, of like what's at stake of getting it right, and what are the negative consequences as well. And looking to get people to move or to make a decision. And that gets back to kind of the other side of marketing, which is changing people's behavior, getting people to move as well, and how kind of that brand messaging flows into the other side of marketing as well. But yeah, I don't know. There's software, but I really wouldn't get too hung up in that. Like Google Sheets, spreadsheets, get it up on the whiteboard, get people together. But yeah, like you said, a workshop or a framework, and just get in a room and hash it out, and have the right people, and get the right voices, and document it, and see what comes out of that.
Yeah, I've been personally been through some fun like virtual post noting exercises with what's important to brand identity, and good for folks to look into that narrative design aspect as well. So anyone else have anything? Laura, you have anything to add to that?
Yeah, I mean, and I've done this with a few cohorts, and this is really old school and not rocket science, but there's a construct for how you develop a brand positioning statement that reads something like this. For target customer and what their need is or pain point, you know, your company is the brand of X that stands out. The competitive framework is Y. You know, they offer certain benefits, and this is the reason why. So I'm kind of bastardizing it. I could show it on my screen, but it's just basically one sentence. And it really forces you to try to get everything in one sentence, that you can really identify who your target audience is, what their need is, what are you solving, what's your brand represent, what's the competitive framework, what benefits are you offering, and why can I believe you? So it's, again, kind of old school, but it's some place to start. And I had some cohorts do it, and one cohort company I'm working with said, Laura, I couldn't fill it out. Because they're trying to do too much at once. And so that was just kind of interesting, and it's a good conversation starter, if nothing else.
Yeah, this is great to hear, and I'm not surprised. A lot of our companies are very ambitious with all of their missions. Great. So, we'll move into, some questions about, aspects of your brand now. So, one major part of this is your website. And so a lot of our early stage startups want to know, especially when they aren't on the market yet. So no one's, going to be, tapping click here to pay or anything, for direct to consumer, and hospitals can't purchase it yet. So what would you put on an early stage medtech website, especially when you're not at this commercial stage yet?
Yep. So I think it depends on the stage. So, just taking you through the different, Series C, or sorry, Series Seed, A, B, C, etc. So at the earliest stage, so sort of the pre-seed or seed stage, it's really about what is that unmet need, or what is that clinical problem that you're trying to solve, and that your solution could be super novel, but the audience is like, what big hairy problem are you going to go after? Because typically you don't have a lot to show for it yet. Um, and then at the sort of seed A stage, it's really about, what sort of clinical evidence do you have? Do you have any pilots, proof of principle, first in human type of data? And really the audience there is typically like, you want to sign up investigators for your clinical trial, or you want to, fine tune the group of investors you're going to go after, or maybe it is recruiting patients for a study, so you want to have like a key information about why is it impactful to them, etc. And then for us, as we went into commercial stage, it's kind of interesting. We were changing the website almost every week in terms of making fine-tune, not like completely, but just making fine-tune modifications and changes, because we can integrate digital marketing tools and get that feedback loop of, okay, well, we have a certain message, we're seeing better clicks for this message, and then we have a different message, and maybe not even A/B testing, but just serially testing slight subtle changes of messages, seeing how different click-through rates or different engagement rates come in. And we're not a D2C company. We're really a B2B. We're a medical device for prescription use only. But it is important for patients to be aware of your products. So really important that you have a section or an area for physicians and all that clinical evidence and data. And you'll be surprised, a lot of patients really get engaged and want to see all that data too. But I would say the through line from the earliest stages to even now is, number one, have a clear message, like one clear message on your website. Number two, it about like, why are you credible? Like, why are you exciting, and why are you credible? And so we had, we are a medtech innovator company. We are, we won this award or something else like that. So it's almost like success begets success. And so don't be shy about like talking about all the successes that you have, and build up from there.
Love the plug to put the MTI logo on your website, and also thinking about it like a mini public data room for people, with all your papers and successes, I think is a really nice way to think about it. So, you talked too about testing out different messages, and, how do you optimize this? So we had a question from LinkedIn for Nick. So how do you balance brand performance versus growth marketing and demand generation performance? So what KPIs and benchmarks do you look at to make sure your brand is effective?
Yeah, it's a great question, and I think it really gets to the heart again, back to the two types of marketing, and it's a balance, because maybe the most aesthetically pleasing or the most clever messaging may not be the highest converting. And it may be a little counterintuitive. And so I love what Shams was saying about how he's testing, and maybe not even A/B testing, but concurrently, to figure out what's working, what isn't. I think that's a great way to go about your messaging. And I almost think about the conversion rate optimization or your performance, the growth marketing as being separate, and run that as a separate process where your messaging ends up being one input into that, but formatting, colors, buttons, call to actions, everything else that goes into it, you kind of run that as its own separate experiments and process, where changing the messaging may be one part of it and changing the design may be one part of it. But after going through many website redesigns, both with ourselves and others, and seeing them, there's a lot of counterintuitive things I think you'll find out when it comes to design and conversion rate optimization and messaging. And so not always the coolest looking is going to convert better. And at the end of the day, you got to really understand what is the goal of your website as well. And so back to B2B or B2C or direct to consumer, like in your website, your website should always have a main goal and a secondary goal. And typically, like in our world, at least at like Greenlight Guru, like B2B, you're trying to get someone to take an action and to learn more about your software and how we could help them. But with a pre-market medical device company where you're regulated by the FDA and can't make unsubstantiated claims, like maybe that's where you could actually lean into your design and your logo, and like brand perception and back to credibility, of showing the MTI or showing other awards or papers that you've written. Like maybe the goal of your website is just to provide credibility because the only people going to your website are most likely going to be your investors. And so the goal isn't to get anybody to take an action, but just to show your credibility. And so I think, again, back to going to what stage you're at and what goal is really important to understand. But it's also definitely a balancing act, of how you measure those two between what you want to say and actual growth or performance marketing.
Yeah, it's great, and really liked, honing in on a main message, but also what is the secondary goal of your website there. So we had a couple questions from our BioTools cohort as well about this, and you touched on this a bit, Nick, how the branding and messaging can differ if you're, more direct to consumer, you're very early, and have to be careful about messaging. But do you feel social media is critical for BioTools companies to engage in for marketing? So more of these B2B companies, and should it be represented differently than a direct to consumer company? So Laura, you want to take that one?
Yeah. Social media, I would say it really depends on what kind of company you are and who you're trying to target and how. Because, let's say you're trying to target investors, you're trying to target, strategics or whatnot. Well, they're all going to be on LinkedIn, right? For example. So do you need a Facebook page? No. Do you need an Instagram page? No. Can you use LinkedIn to kind of tell your story and kind of, show who you are as a brand? Absolutely. One of my sort of favorite LinkedIn campaigns was from years ago. Not a BioTools company, but does anyone remember Verb Surgical? Was a joint venture between J&J and Google, or Verily. And it was based on it was set on the Google campus in Silicon Valley. And they were going to go after Da Vinci. And they were really, really quiet. Like if they hiccuped, it would get an article. But what they did on Facebook or on LinkedIn rather, it was they interviewed all these employees. And it was just about, here's, they didn't give away a lot of secret sauce, but it was just sort of like a little lens into the company, which was really interesting. And that's just one example of one thing you can do, because everybody on this call, you are your brand. You are all marketers. You all represent your brand. And so, I think there's a place for social media. Probably the default is LinkedIn, for businesses like ours, maybe X, and, depending on who you're trying to reach, maybe there's some others. YouTube obviously is important. Visuals are very important, and media. I hope that answered the question. It's kind of hard to answer without knowing more about where the company is, but I think that's broadly how I would answer that.
Yeah, I think that's great. Hopefully it's helpful to the BioTools teams out there. And so Brandon, you've been working with MedTech and also BioTools companies for a while. What are some examples of unique and successful branding strategies that you've seen them implement?
Yeah, and there's a lot of great stuff out there. So I think first of all, what I've noticed among at least the last couple of cohorts of alumni or of our companies that I've been familiar with is we get the basics really good. Companies seem to have good websites, good social presences, decent brand identity schemes and designs. The ones that stand out to me take it a little bit of a step further, and two of the main ways I think that have kind of caught my attention and probably the attention of our judges and supporters and ecosystem are um, we realize that we have five senses. And reading things and hearing things is one thing. So text is critical, visuals are critical. Video does an incredible job of telling a story. And so companies that do either kind of the method of action or explainer type videos, the animation that shows what might happen in a part of the anatomy that the human eye can't see, a really good method of action video displays a benefit more than reading pages and pages of peer-reviewed literature can do, right? Like that's a real good précis for getting to the heart of why this solution is important and why it's better. Um, I think testimonials too can really set people apart. We talk about two different kinds of proof, kind of evidentiary proof, which might be the data, and social proof, which is the recommendations from other humans. We live in a world of Yelp reviews where we take what other people experience to be perhaps more important than what we marketers say. So anytime you can have a KOL or maybe even better yet, a patient or an end user talk about how this medical device has improved their life, how this laboratory instrument has fueled their research. That kind of social proof is really important and really powerful. And there've been a couple of cases where we've seen companies take that one step further, and they actually have brought a patient to an event or featured a patient story in some of their media. And to be able to listen to an actual human show and wear a device and use it, and you get the sense, and maybe you're allowed as a viewer to pick it up and feel it and see how it moves and how it articulates and how small or light it is, those kinds of things. Anytime we can create a more sensual experience, not in the sensual way, but like a more, use all of your senses. I think that's really powerful, and that helps things stick a little more than just what we read or what we hear. So anytime you can create an experience that is fully, to be cliche, immersive, where you get to touch, you get to feel, you get to smell, you get to do all those kind of things, that is helpful. So yeah, I guess that combination of the genuine, authentic testimonial from a KOL or a patient, and the ability to really interact with a product either virtually through a good video or in a physical experience is pretty powerful. The other example I'll mention, which I've used in previous roles, that have small patient populations, but very close-knit ones, is the sooner you can start to have your company work with maybe a patient advocacy organization or one of those kind of communities outside of your own company. That kind of gives you a bit of credibility and shows you're genuine about trying to solve this problem. And I'll be honest, this is a long-term play. This is not a quick solution. It takes time, it takes effort, it takes money. We can do a whole session on how to do this. But I've seen it done in great effect, especially in smaller populations of patients that are very close-knit, where they share their stories and their experiences and their information. And if you can position yourself authentically as a good partner in helping to advance care for this population, especially for products that require some kind of consumer demand to a clinician to get the product accepted or better well known, that can be really powerful as well. So the third thing would be companies that go and kind of look beyond the traditional marketing channels and look how can they develop other evangelists for their product, not just through clinicians or scientists, but perhaps through patients or end users.
I have a good example of that.
Yeah, sure.
So I might have brought this up on last year's call because I talk about this a lot. I don't know how many women are in the audience, but almost half of all women have dense breasts, and what that means is their tissue in their breast is dense. And basically cancer on a mammogram hides in that dense tissue because cancer is white and dense tissue is white. So I know that a lot of people don't even know that. And now there's legislation that's requiring, and in some states it's been this for a couple of years, where if you get a mammogram and you have dense breasts, you get a letter saying you have dense breasts. The challenge is it doesn't really tell you what to do. It tells you, well, talk to your doctor. And then some doctors are like, oh yeah, you're fine. There was a founder of this group called Are You Dense? And she had a clean mammogram. And then I don't know if it was a couple months later, she had breast cancer. It was not found. And she was horrified. And so she went to her legislators and said, this is ridiculous. We need to have secondary screening. She started this, she fought hard. She was in remission. She passed away. Her heart, with all the chemo, just went out. But there are so many, there's Dense Breast Info, there's a whole bunch of groups of women who are trying to get this issue put to the fore. And one of our clients has developed an imaging system directly to measure and to find cancers in dense breasts. They went through a long PMA process, and they're very involved with those groups. And this is a large population, so it's not a small, close-knit population like Brandon's talking about, but it's a significant portion of the population. And they're still doing their work, because if you can believe it or not, I mean, this is all really supported in literature that there's an issue here, and that you should have either secondary screening with ultrasound or mammogram, or MRI, or our client's technology, which is a new form of ultrasound. But it's, the guidelines at the national level still don't say you need secondary screening. They say there needs more research, which, as a woman with dense breasts, and like I have 4 people on my team with dense breasts, it makes me really mad, and I have to advocate for myself. But that's just one example. And, this is an emotionally charged issue. We're talking about cancer. But those groups can be very powerful.
I'm glad you brought that up, and yeah, very powerful story, and way to bring the patient advocacy and perspective into it. So tying back to Brandon's point about having authentic testimonials, people that could
Yes.
or would have benefited from your technology is so critical. And we've got our best video submission deadline in less than a week, and one of the really powerful things I like to see in these is when people start out with a testimonial like that. And of course, Brandon mentioned other sensory experiences, so like good music, things like that in your videos play such a strong role. So really glad you brought up those stories. Thank you guys, and hope that company has a lot of success. I know a lot of people in my life with that as well, Laura. So we've got another question from LinkedIn I want to make sure we tackle before we head to the private cohort Q&A, which is, how do you maintain brand strength when you are working through a distributor that has many items on their line card, potentially one or more that compete with your product? Let's take that. Laura, you want to take that?
Sure. I mean, that's not an uncommon problem. Without knowing what this technology is, I mean, you have to give the salespeople a reason to want to sell your product. You have to have a compelling story. And if your story of what your product does is a Me Too or a commoditized product or anything like that, I mean, it's not going to stand out, right? So, I'd love to know more about the person who asked this question in terms of the kind of device it is, but you really have to, work with your distributors to train them, give them the tools, so they can, be successful on your behalf.
Good answer. Brandon, you have something to add to that?
Yeah, so I had worked this for a larger medical device company. I'd worked for a capital laser manufacturer a little while ago, and we sold direct in many countries around the world, but we also sold through third-party distributors in many parts of the world that had just that same issue of we had independent reps carrying multiple products in a bag. Some of them were competitive, and I think to build upon what Laura was mentioning was we made sure that they understood through lots of training and lots of reinforcement, frankly, the unique value of our product. But we also made sure that they had all the materials they needed to help support the sale of the product. So the videos, the brochures, the point of sale pop-ups, all those kinds of things, and that every other part of working with us was frictionless and effortless. So every customer service transaction, every financial transaction was very smooth with us, smoother than with the competition, and just tried to position ourselves as being the partner of choice to work with, not only for the quality of our product, but for the support that we gave them as well. And I think if you can try to do those kinds of things at whatever scale you're at, to be the whole package, to not just have, again, that best product, but also make sure that the process of working with you, that they feel well supported, well cared for. You are not their problem child and they are not yours. Again, bit of a long-term play, but that's how we found success, at least in that particular market.
That's so great to hear. So we'll end with one final question, which, we talked a lot about how you're facing your company to the world, but at the beginning also touched on how brand is important internally. So someone from the BTI cohort asked, what is a useful way to instill your brand message across employees in your company? So Sham and Nick would love to hear from you on this one.
Yeah, well, I think that's one of the first things that we did when we founded the company is like, what are our values and our principles, on, who are we all about? And we have a number of principles, but the most important one is never lose sight of the patient. And we did this as, what we truly believed in at the earliest stage of founding the company. And that has really been a guiding light throughout our entire journey. We've pivoted, we've gone through ups and downs, and every time, we face some difficulty or challenge, we just look back at that statement and like the decision becomes a lot easier when you're trying to juggle many different stakeholders and many different, avenues or paths you can go down, but then like refocusing or reframing it back to the patient. And that's really, that culture has permeated through our company. People, our employees, fantastic, have joined us because they want to make that impact on patients. And, we're blessed to be in an industry where, it's not as glitzy as, some of the high tech, gadgets and products, but these are really impactful technologies that help a lot of people in the world. So, we sort of leaned into that with that message. And then I would say that it's important to not just communicate it internally with internal facing communications, but also it's important to communicate that externally about how you're building that culture from within, because you always, if you're successful, you're going to be hiring. You want the best people. You want to recruit from a broad pool of talent. And so it's important, the best people are looking for companies, that are mission oriented or, are going somewhere because they truly believe in it. And that's really the best kind of person that you want on your team. So I would say that internal means both internal and external, but for the goal of building out your culture.
It's really good advice, Sham. You're going to probably have like 10 resumes in your LinkedIn inbox soon from everyone thinking how wonderful it is to work in your company with that message. Nick, what do you have to add to this?
I think Sharm nailed it. I wouldn't add a ton, but it really is about establishing your mission, vision, values, and then just being consistent again and again, and harping it back to and bringing hard and difficult decisions back to your values, and that's why it's important to have those values and to establish them and to move them. And also on the mission-driven company point of going always back to the why. Our founder CEO at Greenlight, David Durham, had built companies previously and really understood after doing it for 20 plus years, like at the end of the day, culture internally was the true differentiator. And that really became by being a mission driven company and living your values and your mission and your vision every day. And it comes through consistency. Similar to, I think, internally, we're all more likely to get, I don't want to say annoyed with the message, or believe that we've heard the message too many times, but I don't think you can say something too much. And it's kind of like with the message in the market. You can continue to say it again and again, but I don't think people can hear it enough. And so just knowing who you are, what you stand for, and then consistently talking about that and bringing it up and bringing things back to why you're doing it.
Oh, great answer. Love that. And really ties the story together of just how important it is, internal and external, to convey your story, tell it in the best manner for all the audiences that are critical to your product's success. So with that, we will end our public portion. Thank you so much, Brandon, Laura, Nick, and Sham. Really appreciate all your insight. I know the both of our cohorts are going to come away with such an incredible new appreciation, understanding for their marketing message. So cohort, please stay on for additional private Q&A, and for everyone joining in LinkedIn. Thank you so much.